We start with the extended dispute over medical reform. The government plans to allow interns and residents to get training at not only large hospitals, but also smaller ones. In the meantime, some professors at major hospitals took another day off while patient concerns grew. Eun-hee reports.
The government is going to restructure the country's medical residence training system to allow interns, residents, and other specialists to train not only in high-level general hospitals, but also in regional general hospitals and clinics. In addition, instead of the current tendency of people primarily seeking any sort of care at major hospitals, leading to competition for other non-urgent medical services, clear and distinct roles will be laid out for healthcare institutions at all levels. This could mean an increase in medical costs for those who haven't been given referrals from smaller hospitals or those with minor ailments that choose to seek care at high-level general hospitals. Such discussions took place during Friday's second meeting of the Special Presidential Committee on Medical Reform.
The government intends to promptly discuss ways to reduce the dependence on trainee doctors in high-level general hospitals.
The government also addressed the shortage of doctors in critical areas of medicine and that they will enhance compensation systems. At Friday's Central Disaster and Safety Countermeasure Headquarters meeting, Prime Minister Han Duck-soo said the government will ensure strict safety measures to ensure that all medical practitioners treating South Korean citizens are fully checked and verified. This comes as the Health Ministry announced earlier this week that it plans to allow doctors with foreign licenses to provide medical services in the country. But this will be limited to when the healthcare alert level reaches serious, as it is now due to the walkout. However, organizations representing doctors immediately criticized the decision, alleging it would result in a huge decline in the quality of medical services. During the meeting, Prime Minister Han also urged medical professors who are suspending outpatient treatment for 1 day a week this Friday to remain with their patients.
I hope the doctors act in the best interest of the patients. I believe that the majority of doctors who are at the hospitals are already doing so.
Medical professors began taking a weekday off each week starting on April 30th due to fatigue from covering for the thousands of trainee doctors who left their positions in late February. While this is not expected to lead to any major disruption to the medical system, patient concern continues. Medical professors will continue to provide inpatient treatment and surgery for emergency or critical patients. During Thursday's press conference, President Yoon highlighted the absence of a unified alternative proposed by medical organizations. To this, the head of the Korean Medical Association on Friday countered by urging the president to go back to square one and reconsider the medical school enrollment quotas and the essential healthcare policy package. Meanwhile, the government said it will be submitting supporting data for the increase of the admissions quota as requested by the court by Friday. Eun-hee, Arirang News.